Our next speaker is KPAC Executive Member Representative Jill Tokuda. Elected in 2022 to represent Hawaii's 2nd Congressional District, Congresswoman Tokuda currently serves on the House Committee on Agriculture, the Committee on Armed Services, and the Select Subcommittee on the Coronavirus Pandemic. Congresswoman Tokuda also founded the Congressional Bipartisan Rural Health Caucus, which provides a forum for members of Congress to advocate for policies that aim to improve the accessibility of healthcare and mental health services in rural areas. Let's give Congresswoman Tokuda a warm welcome.
Aloha, I'm Jill Tokuda, the representative for Hawaii's 2nd Congressional District. Mahalo to APAICS for inviting me to speak. It's a pleasure to be with all of you today. Since my first day in Congress, access to quality, affordable health care and mental health services, including for our AA and HPI communities, has been among my top priorities. As co-chair of the Bipartisan Rural Health Caucus, I am committed to supporting the health and well-being of our patients, improving the financial stability of our providers, and addressing the myriad of healthcare access challenges facing our rural and remote communities. As a caucus, the vision we have is simple. Everyone, regardless of where they live, how much money they make, or their life circumstances, deserves access to high-quality, affordable healthcare and mental health services. And I'm making sure that the voices and experiences of our AA and HPI individuals are represented as part of this effort. As many of you know all too well, across this country, our communities face higher rates of cancer, hypertension, obesity, diabetes, tobacco use, and cardiovascular disease compared to other racial and ethnic groups. The health inequities and disparities that plague AA and HPI subpopulations are the direct result of factors such as access limitations, lack of trust in the healthcare system, lack of cultural competence and multilingual skills, and clinician bias. As we saw over the last few years, the COVID pandemic had a profound impact on AA and HPI communities in terms of health access, mental health, and worst of all, public safety. In fact, the pandemic shined a spotlight on systemic and racially disparate barriers that have limited healthcare options and led to worse health outcomes amongst our people. Achieving health equity for AA and HPI communities will require a commitment to cultural competency and inclusive and intentional approaches to healthcare. In my home state of Hawaii, Medicaid has been critical to delivering quality, affordable healthcare, supporting culturally tailored care models, and creating healthy families and more resilient communities. That is why I am so proud of the work our state's MedQuest division and healthcare organizations like Papa'olakahi in supporting, their health coverage for culturally sensitive and linguistic appropriate health interventions. This has been critical for our community. To ensure continuous uninterrupted coverage during the unwinding Medicaid period in Hawaii, our state Medicaid has put resources and made them available in 14 languages, including Japanese, Ilocano, Hawaiian, Chuukese, Spanish, Vietnamese, amongst many others. Our state has also been utilizing federal flexibilities to provide benefit expansions and address social determinants of health, including by covering, such traditional Native Hawaiian practices as hula, lomi lomi, la'a'au lapa'au. Again, traditional methods such as these massage therapies and medicines being made available to our patients. Coming out of COVID, these are just some of the examples of the ways in which we can and must work diligently to protect individuals and families from losing health coverage and keeping our AA and HPI families and communities from getting left behind. Mahalo again for the opportunity to join all of you today and for all the advocacy and work you're doing to elevate the health and needs of our people. I look forward to our continued partnership in keeping our AA and HPI communities healthy and safe. Aloha.
Our next speaker is Representative Young Kim, who proudly serves California's 40th District. Representative Kim is currently co-chair of the Maternity Care Caucus and is currently leading efforts to reintroduce the Stillbirth Health Improvement in Education, or SHINE Act, a bipartisan bicameral bill to prevent stillbirths. Let's give a warm welcome to Congresswoman Kim.
Hello, I'm Congresswoman Young Kim, representative of California's 40th Congressional District, which covers parts of Orange, San Bernardino, and Riverside counties. I'm excited to join you virtually at this year's APAICS Health Summit. Thank you to all the community leaders here to discuss and advance healthcare issues that are important to the AAPI community. During my time in Congress, I have been passionate about expanding access to and reducing costs of healthcare. This passion stems from my own journey to achieve the American dream and raise a family here that many of you or your parents and grandparents' generation may relate to. My family and I came to the United States in the aftermath of the Korean War. English was not our first language, and it was challenging to navigate the healthcare system here, from expressing our healthcare needs to simply knowing what resources were available. Now, I'm living the American dream and represent a diverse district with Americans of all different backgrounds, including the members from the AAPI community. I'm thankful for the opportunities that our country gave to me and my family, and I'm passionate about expanding those opportunities to others, including by improving language and telehealth resources. That's why I introduced the Healthcare Act with Representative Grace Meng of New York. This is a bipartisan bill to create a universal language access symbol. It's a simple, consistent, and low-cost way to inform patients that language access resources and translation services are available at a healthcare facility. There are over 25 million limited English proficient Americans, and my bill ensures that everyone, regardless of what language they speak, knows exactly what healthcare options are available to them. I also helped introduce the bipartisan SPEAK Act with Representative Michelle Steele of California, which creates a task force to establish best practices to expand healthcare information technology, including telehealth platforms and patient portals for non-English speakers. The COVID-19 pandemic is over, but telehealth and innovative approaches to healthcare delivery are more important than ever. The pandemic also fueled the mental health crisis in our country and in AAPI communities. Unfortunately, we all know that the stigma around mental health and seeking help in Asian communities is still a serious problem. As co-chair of the Maternity Care Caucus, one of my priorities is oversight of the Maternal Mental Health Hotline, which is a product of the Into the Light for Maternal Mental Health legislation that I was proud to champion back in 2022. In the hotline's first year, only 6% of health seekers were Asian, and only 0.1% of the contacts requested translation services. As the hotline's reach expands to cover more languages, my goal is to ensure that more AAPI mothers and families seek the help that they need without the fear of or societal pressures. Thank you again for the opportunity to speak to you today. I wish you a productive summit, and I look forward to working together to uplift our AAPI community, and will continue being your voice here in Congress. Thank you.
Our next panel is Bridging Gaps, Advancing Healthcare Accessibility for AA and NHPIs. As distinct yet interconnected communities, AA and NHPI populations face unique barriers to healthcare. In 2022, the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders outlined 3 key policy priorities to advance health equity for these communities: anti-Asian hate and violence, data disaggregation, and language access. The U.S. Department of Health and Human Services created an action plan providing examples of expanding, delivering, investing, and engaging with communities to reduce health disparities. Public health, healthcare policy, and community advocacy experts will discuss some of the strategies for overcoming these challenges and advancing equitable healthcare access for both groups, including patient engagement, telehealth, and the unique concerns of our growing aging population. Our moderator for this panel is Ðoàn. Ðoàn is an assistant professor in the Department of Population Health, Section for Health Equity at the New York University Grossman School of Medicine. She is a social epidemiologist with training in applied research and conducting community-based participatory research working with racially and ethnically diverse, low-income, and limited English proficient communities. Lana also works in close partnership with Native Hawaiian Pacific Islander community partners and serves as a trusted scientist for the Research Network for the Native Hawaiian Pacific Islander Data and Research Council. These interests reflect her personal commitment to promoting health equity and research and mentorship for historically marginalized and underrepresented populations. Please give her and our next group of panelists a warm welcome.
Thank you for the introduction, Madeline. Hi, everyone. My name is Dr. Langone. As a public health researcher immersed in community engaged and participatory action research with Asian American, Native Hawaiian, and Pacific Islander communities, I'm really thrilled to be your moderator for this panel of leaders today. We're going to delve into the critical conversation of advancing healthcare accessibility. Please join me in welcoming our panelists. We have here today Dr. Rita Kuwahara, primary care internal medicine physician, Sean Kolasker, public health informaticist from the Alexandria Health Department, and Linda Murakami, head of health equity at Amgen. So before we dive into our conversation, let's set the stage with some context. In 2022, the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders zeroed in on 3 key issues: anti-Asian American, Native Hawaiian, and Pacific Islander hate and bias, data disaggregation, and language access. These intersecting issues profoundly influence health equity. The initiative proposes to boost efforts to improve health outcomes, eliminate health disparities, and broaden access to quality, affordable, and culturally competent medical and mental health care services for Asian American, Native Hawaiian, Pacific Islander communities. At the same time, the U.S. Department of Health and Human Services rolled out the Equity Action Plan. So this report underscores strategies to expand access to in-language content by addressing language barriers so that individuals and the broader community can get the information, services, and benefits they need from federal health and human service programs. Now, as we reflect on these long-standing health disparities that the COVID-19 pandemic worsened, and the invisibility of Asian American, Native Hawaiian, and Pacific Islander communities in health equity discussions, it's clear that healthcare accessibility is a critical piece of the puzzle. So with this context, can you all describe your specific roles and work on this topic of increasing healthcare accessibility for Asian American, Native Hawaiian, and Pacific Islander communities? Let's start with you, Sean.
Well, Professor, thank you for the introduction, and Madeline and all of APAICS, thank you for the invitation to come speak on this. So, like Len mentioned, I am a public health informaticist, and so I look at a lot of problems through a couple of different lenses, but primarily through a approach and understanding the data that underlies what we're trying to accomplish. And so I think when we look at it at a local health department, we are looking at, are we serving the population that needs the help? And so we often kind of fall back towards understanding, can we look at our data and disaggregate it? And I think data disaggregation as a term has become a buzzword. But what we look at is, are the data sources that we are ingesting, as well as the data that we are generating, accommodating the fact that our community in Alexandria, in the Commonwealth of Virginia, and kind of across the country is incredibly diverse. And personally speaking, is the Asian American population, the Native Hawaiian population, the Pacific Islander population being accurately captured in terms of who we are serving, who we need to serve, and who's potentially reaching out to us because they've not been able to access healthcare through other traditional means. And so I think one of the things that we look at doing is trying to understand what systems do we have in place to help disaggregate that data, and what strategies do we need to implement in order to disaggregate the data that we're receiving from other sources. The other thing that we're trying to look at is disaggregating data is fine in theory, but one of the things that we try to implement it is by applying that disaggregation to other social determinants of health. I think one of the things that a public health department does is we are constantly looking at how is a person's health tied to all these other components that are part of their life, be it access to housing, access to nutritious food, access to other types of care like dental care or child care or adult care. And so how do we wrap all of those components and assess all of those components while looking at all these groups in a very, very granular fashion rather than trying to lump everybody together either geospatially or within a incredibly large racial and ethnic grouping. So I think that's some of the work that we're trying to do at Alexandria and in the Commonwealth to help bridge the issue in terms of access to healthcare for all Commonwealth residents, including Asian Americans and all our compatriots.
Thanks for sharing, Sean. We know that data disaggregation has been a long-standing issue for Asian American, Native Hawaiian, Pacific Islander communities, and we need to think about not only prospective and retrospective data sources, but also what type of data we are collecting. Dr. Kuwahara, can you talk about your experiences as a clinician?
Of course, and thank you for the opportunity to be a part of this. As a primary care internal medicine physician, my highest priority is making sure I'm delivering the highest quality and best care to my patients to make sure that my patients can have the best possible health outcomes. However, sometimes the research is not comprehensive, and if we don't have data that's disaggregated by race and ethnicity, then we might not really understand what evidence-based approaches would best improve our patients' health outcomes. And so that's some of the work that I'm doing. And I know that we have the session to go into more detail, but at a high level, I think the biggest issue is to be able to apply evidence-based research to clinical practice and make sure that the research that we have is the most comprehensive and covers and is disaggregated so that we really understand the nuances within and among communities to address health needs.
Thank you, Dr. Kuwahara. As you mentioned, the issues of data disaggregation are far-reaching and has very important implications both in the clinical and research settings. And it's not just data that we're talking about, it's people. Linda, can you tell us more about your role in bridging healthcare gaps for Asian American, Native Hawaiian, Pacific Islander communities?
Absolutely. And Lan, thank you so much. It's quite an honor to be here to share the work that we're doing at Amgen. I have the privilege of leading our health equity work, and for us at Amgen, it is a true priority. Our goal is to advance policies, priorities in support of achieving health equity so that people can live the healthiest life possible. For us, that means making sure that especially ethnic and racial communities are represented in research, tailoring educational materials, making sure that there's true access to healthcare and to treatments. We don't often find that that is true for some of the smaller racial and ethnic communities. For us, it really comes down to inclusion, location, and language, making sure that we are not kind of over lumping together certain populations, that we're always thinking about where we locate and where our partners, whether we're talking in the healthcare community or our nonprofit community partners, where they locate their services. We like to think about things like language translation. And making sure that we are working with trusted partners from the community. For us, it's really about making sure that the messengers are the ones who are delivering the message. We find that when you don't have that, you do have a disconnect, and instead of bridging a gap, you actually create a larger divide. So those are some of the things that we at Amgen do to really kind of double down in this space.
Thanks for sharing that. Trust within the community and with healthcare partners are so instrumental in moving this needle. So you all touched upon different aspects, your respective organizations, and you have been moving this needle towards equitable healthcare access. Can you talk a little bit more about the specific initiatives you're involved with, perhaps the things you're most excited about, and importantly, how this work is impacting Asian American, Native Hawaiian, and Pacific Islander communities? Dr. Kuwahara, would you like to start us off?
Sure. From a clinical perspective, as well as some of the other work I've been engaged in, I've been focusing on hepatitis B and diabetes, two conditions that disproportionately affect the Asian American, Native Hawaiian, Pacific Islander communities. But when talking in the context of our current discussion, I think there are a few things that I'd like to highlight. For example, it was wonderful when a couple of years ago, the U.S. Preventive Services Task Force recommended screening for diabetes for anyone who is considered overweight or obese. And overweight in the definition in the U.S. is a body mass index or BMI of 25 or greater. However, in different Asian sub-communities, according to the World Health Organization and some of the other international guidelines, overweight could be considered anything from a BMI of around 23 or higher, which would mean that it might be more appropriate to screen individuals of Asian descent or some of the Asian communities at a BMI of 23 rather than 25. However, with the way that the guidelines are in the US, that is not something that would be covered by insurance necessarily. So that's a coverage issue, but there's also a knowledge and awareness issue because many clinicians are not aware of international guidelines around diabetes screening. And so I think it's really important to make sure that clinicians are educated in order to address those needs. Another area that I've been working on is addressing hepatitis B. And for years, we've had risk-based criteria to screen and vaccinate individuals at greater risk for hepatitis B. However, risk-based approaches really don't work. And so I was engaged in some of the initiatives that led to the recommendation for universal adult hepatitis B vaccination. And then the CDC also more recently recommended universal hepatitis B screening for adults. However, that guideline has not been adopted yet by the U.S. Preventive Services Task Force. But again, it's both meeting the needs of the community, but also making sure that our clinicians across the country are aware of these updated guidelines and so that they're able to offer and provide the appropriate care to reduce health disparities and improve health outcomes.
The work to reduce, you're exactly right, Dr. Kuwahara. The work to reduce health disparities for Asian American, Native Hawaiian, Pacific Islander communities is multifaceted. It must involve trust building, community engagement, and education at multiple levels, as well as really rethinking clinical guidelines based on this new evidence base that we are developing. Linda, can you tell us more about what you're doing and what you're most excited about right now?
Absolutely. So for us as a heavily research-based organization, looking at bringing new and innovative treatments to the fore, we really focus on ensuring that our research programs are representative. Certainly, the focus on ensuring diversity in clinical trials is one that the entire industry is heavily focused on. And for us, it's important to not look at the Asian American, Asian community as one. To make sure that we are talking about Native Hawaiians, Pacific Islanders, and within the Asian American community, there are so many subgroups that we need to be thinking of and respectful of. So for us, again, it goes back to making sure that education is in language. We have a great partnership with New Tang Dynasty, and the information that they share is translated into several hundred languages. For us, it's really going to a source that has really bred trust and access into community and making sure that we can get materials that are created not by us, but by them to distribute. They know exactly where to put it, where to place it, what's most successful, like what the uptick looks like for certain, different types of information. Is it a flyer? Is it something that you would share, like a printed copy in community centers and churches, and the like. So for us, it's really thinking in a much different way. We also support a great organization called the Lazarus Foundation. And they work in communities, again, targeting. There are a couple of great partnerships that we have with them around healthcare hubs, a couple around the Los Angeles area, where they go to community fairs or they go to community events where they can actually provide information about their services. Things that they fund and support that are very, very unique are language translation services, like in language and in community appropriate navigators. And we find supporting those types of events and activities is really useful.
I think it's great that you're involved with such a breadth of work. I think when we think about diversity in clinical trials and research, it's not just about the diversity of racial ethnic groups, it's also language, socioeconomic and age diversity. And I think it's really important to put this context and consider health and healthcare access across the life course. So thinking about health from in utero, early life conditions, adulthood, and then older adulthood. I'm going to pivot now to Sean to share about your work in the public health department.
Yeah, so I think one, to say thank you to Linda and Amgen for starting this work. I think part of what we've talked about earlier is this entire process of trust building with our minority communities, right? I think part of this is having evidence and examples of this massive ship called U.S. healthcare slowly pivoting to acknowledge, everybody's individuality and individual needs, whether it's community oriented or if it's racially or ethnically oriented, recognizing that there are these larger players that are starting to acknowledge that. And that's something that we at the health department try to serve as a conduit to our populations. And a lot of that happens by utilizing community health workers to actually go out into the community. So Linda was referencing some organizations that they work with. We need to do that on a daily basis. And so we have a team of community health workers that actually go out and interact in apartment buildings, in community centers, at places of worship, at restaurants, and other places where folks are congregating. And specifically for the Asian American and Asian American population in Alexandria, a lot of what we're trying to do is, one, demonstrate that there is some level of cultural competency that the health department is continuing to grow, but then also demonstrating that we have resources and assets that are been translated into their native languages, been translated by community stakeholders and community leaders, and then been validated by these third-party champions. So I think that's something that we strive to do and need to continue to do, because one of the Alexandria Health Department's core missions is to be a trusted voice in the community for health. And the only way to do that is to show that we're listening to that community and collaborating with that community. I think from a data perspective and a data modernization perspective, I think we look at that as, how do we use our data to inform our work? And so, it could be something as simple as recognizing that when we have a scheduling tool, when we want folks to come in and schedule a vaccine appointment, be it for the flu shot or the COVID shot, or if we have families that are signing up to get their school mandatory vaccinations, making sure that front door is easily translated into multiple languages, and it's not just English and Spanish. And when we say translations, as much as I love Google, we're not just saying, hey, here's Google Translate's version of this. No, it's an actual version that has been vetted by a translation service, by native speakers, and then dropping that text directly into the website, so that you're not dealing with even as a data person, I know that Google Translate is not 100% accurate. So how can we provide a culturally appropriate translation for our services so that populations can consume that information in the language that they're most comfortable with, and at a level that they're most comfortable with? So I think those are some of the things that we're trying to do at the health department level to meet especially our Asian American community, kind of where they're at, build that trust, and ask them to work with us so that we can help the larger community. And I think the other part is that we try to continue to do is that we still need to talk about just our overall shortage of clinicians, right? We've got Dr. Kuwahara on the call right now, but she's one, and we need 1,000 more of her in the Commonwealth of Virginia, in the Mid-Atlantic regions, just so that we can meet these needs, not only at a primary care level, but for dental care and for mental health, and especially pediatric mental health. These are areas that need additional providers and clinicians that look like their patients, that understand their patients' lived experiences. And so that's one of the things that we've been focused on, is how else can we support our communities?
You bring up a lot of important and key challenges, Sean. I think we know that this work to bridge the gaps in healthcare access and reducing healthcare disparities for Asian American and Native Hawaiian Pacific Islander communities is not easy. These initiatives are works in progress. Linda and Rita, can you share a little bit more about what the major challenges have been or are in your work, especially if they overlap with the challenges that Sean have mentioned, and how you have overcome them or lessons learned?
Sure, I'd be happy to start. So some of the challenges, and Sean did a great job of outlining a number of the gaps. When I think about the work that we try to do in community, for us, it's really important to show up and to show up in the right way. So to have folks who look like representatives from the community, people feel very comfortable when you have somebody who has the same background, comes from a same, walk of life. No surprise to everybody on this call, right? Each of us comes from a very specific culture. And knowing that and knowing how to talk to members of the community, elders, certainly peers. I mean, just, I'm fortunate enough to be like third generation, but my grandparents were first generation. And when you're speaking to folks who are first generation, it's very important to be very respectful and to understand, a certain manner of communication. So for us, it's really important that not only are we thinking about the communities, but when we show up in the communities, we show up. We are happy to fund programs, but it's very important for us to be alongside of our partners as Amgen in the community. So for us, it was a bit of a learning internally to say we really do need to make sure that we have access to a broad range of employees from a number of functions, whether it might be a researcher, it could be somebody from our government affairs shop, right? It could be somebody who is on the line, who's a part of manufacturing one of our treatments. So for us, it's really taking that thoughtful approach to how we show up in addition to what we fund, making sure we have the right partners, and making sure that this is not a one and done, that it isn't like a need for a moment, but it's really a continuum. For us, it's to say, we as a company, every patient, every time, but it's also every community in a sustained manner so that they can count on a presence and a support. And they know that we really want to make sure that, health for all is something that not only can they attain when in crisis, but they can attain in a holistic fashion. So some very good learnings for us, work in progress, certainly the opportunity to continue to grow it, but for us, it really has been anchored in community and really trying to take those learnings kind of start to finish.
It's really lovely to hear. We know that like cultural humility education is so important, but it's really our continued actions and like building upon like actual action and authentic engagement and relationships with the community. Dr. Kuwahara, would you like to add any challenges or lessons learned from your work?
Yes, so there are a few different aspects that I'd like to address. One challenge that we've encountered is just having amongst clinicians low awareness of certain guidelines that should be considered when taking care of patients who are Asian Americans, Native Hawaiians, or Pacific Islanders. There's also the insurance coverage issue, which I spoke to earlier, but as a physician, when I'm taking care of a patient, I want to make sure I'm delivering the best care I can to my patient. But when there are guidelines that don't quite align with some of the knowledge that we either have or we need to develop, it becomes much harder to ensure that our patients get the care they need, because insurance companies might deny claims or coverage of certain services if they don't meet the standard generic criteria. And again, I think that it's important to follow the clinical guidelines, absolutely, but we also need to think about how those guidelines are developed. And that gets into the third part of what I wanted to talk about, and that is that we need to have the resources and the prioritization to disaggregate data so that we have good data to make decisions. And there are a few different components to that. There's one where we really need to make sure that when we have clinical trials that we are having very diverse communities be a part of the clinical trials. And so we have increased representation and see if there are differences in outcomes when those trials are occurring. Also in the research, we need to be able to do that. And I've also been engaged in health services research, which is dependent on the data that's already there. And the problem with that is often, for example, the Native Hawaiian Pacific Islander communities are completely left out. or they're considered so small that it's not a way to statistically analyze that data. And it's a problem because we can't just say that, oh, the subset is too small, so we're just going to take it out, because there's a whole story that might be told in that data. And we need to dig deeper to really understand what's going on there. And the same way, Asian Americans are not a monolith. Like it's such a diverse community that we need to be able to disaggregate that data and have a deeper understanding so that we can better interpret the data that we're collecting, so that we can then engage in research or develop guidelines or other recommendations to improve the care of our patients.
I think to sum up what I'm hearing, I think also thinking about the quality of data disaggregation. We know that it's so important for Asian American, Native Hawaiian, Pacific Islander communities, but thinking about the trajectory of where data are collected from, how they're analyzed, how they're reported, and how they then inform clinical guidelines and evidence-based interventions. We have to think about the quality of this data, not just for these deemed small n-size communities and ethnic groups. It's also thinking about the multiracial, multi-ethnic populations and how they are showing up in the data and then in evidence-based healthcare interventions. So thinking about these challenges you all have mentioned, and also the strategies and what we know needs to be in place to overcome these challenges, how can the government and private sector come together to better address these challenges and support these solutions? And are there specific entities that would ideally be engaged if they aren't already? So Sean, how about you start us off?
Yeah, so I mean, to piggyback exactly what Dr. Kuwahara was saying in terms of data disaggregation, I think, so I'm an informaticist, and a lot of the things I look at are data oriented. And so for me, not to make every problem, when you're a hammer, not every problem is a nail, but every problem kind of looks like a nail. But I look at it as we need to have a little more guidance and leadership from the CDC as part of their larger data modernization initiative. I think the CDC has taken great leaps in terms of pushing healthcare and especially public health towards modernizing the infrastructure that we're utilizing for holding and utilizing our data. But I think that there needs to be a renewed conversation and an expanded conversation about the data governance that goes into these different systems, and the disaggregation of racial and ethnic data kind of falls under that larger umbrella. And I think that there are pockets of folks that are having that conversation, but the place that needs to be had and the place that needs to be led from is from the federal government, specifically the CDC, primarily because they're the ones that hold the purse strings for the data modernization initiative grants that go out to the state departments of health and local departments of health. So I think that isn't a ripe opportunity for a federal level partner to make real meaningful change in this space. I think the other part that we look at that would be invaluable is to identify expanded, but more importantly, stable funding streams for community health workers at public health departments, right, or at local health departments. I think the value of a community health worker, and I think both Linda and I've talked about this, is like having a person from the community that looks like the community going into the community to talk to that community and build trust with that community is incredibly important. But it doesn't happen as a one-off, right? Like you need to have that person go there over and over and over and build relationships. And one of the things that we've seen is that there's incredible value for hiring a community health worker from the community that you're trying to target and then turning them around to go back into that community, because it shows a sustained long-term investment in wanting to help that community's health. And so that's only possible when we have stable funding. When you're funding community health workers through Medicare reimbursements or insurance reimbursements or grant funding, there's so much variability that becomes really hard to continue this work at an expanded and stable way. So I think this is a place where we could utilize stable funding to have exponential increases in value and access to our healthcare for our community specifically. I think other than that, I think one other thing is that we as public health operators need to do more to create evergreen content that increases the health literacy of our populations. It is something that we try to do. We are in the process of generating that content, but I think we need to continue to do that because it's not a one, like, you don't do it once. You can't just, you have to create it, you have to adapt it, you have to update it, and you have to make it culturally relevant. And so it's something that we need to do, and we need to do with our partners.
Linda, what are the ideal collaborations that you envision in this work?
Thank you for that question. So for me, and disclaimer, decades-long policy person, so I always look to policymakers. I think at both the federal and at the local level, these are really important things that should be handled in a high-level uniform manner. It can do a number of things. It can provide really a roadmap for the various programs and gaps to be filled, but also funding. And I think each of us have talked about the importance of making sure that programs are funded. And I think that is one way to do it. One thing that comes to mind is the Health Equity and Accountability Act, which is something that I know has not actually been successful, but I feel like what it does is it shines a light on the need for health equity to be taken up. And so from my perspective, both a good reminder, something that policymakers who represent the large communities can certainly band together to talk about. When I think again about the community level, and I spend a lot of time thinking about it because I believe from the grassroots up is a very important way. And it's oftentimes where the best solutions come from, right? Instead of taking an approach that's one size fits all, it can be the place where communities can build into policy the need for certain assessments to be done. I think they can be done in partnership with communities. As we've talked about, it's very important, given our healthcare system, that again, we have industry at the table, right? That we have very important state health departments, like Sean and his colleagues and others. We've referenced, certainly the CDC, I think of NIH. I think when you have everybody kind of cohesively working together, I think a solution could be made. But I really do think that, working with policymakers is really critical in this space.
I absolutely agree. It's really nice to hear not only the breadth, but the commonalities across your different work and impact across like various sectors. As examples as how we can make equitable healthcare access actionable. So thinking ahead, what are upcoming opportunities that we should know about and future innovations that we should be excited for? I will start and circle back with you, Linda.
Thank you for that. For us as a research company, we're very excited about treatment innovation. And for us, it really does circle back to the opportunity for us to start early days, making sure that we have great representation and very targeted and tailored representation as we do our research. I think for us, we take that through the continuum with the hope that we end up with an approval and a treatment. But for us, it's if we're talking to a community before we actually have a treatment, we're building that inclusion and that trust. And then when we have a treatment, the community can understand who we are and that we're in the community and with the community through the continuum. So for us, that's really exciting. There are a number of things in some disease areas that are particularly relevant to the community that we're speaking about, the Asian American, Native Hawaiian, and Pacific Islander community. I do want to say the other thing that comes to mind is the work that we do when thinking about the Native Hawaiian and Pacific Islander community. Not only do they have an island system and geographic challenges, but you also have the mainland population that have many of the same similar health-related concerns, but they have presented very differently. So for us, we think about those things slightly differently, but those are some exciting things that we have on the horizon.
I think we know that solutions are not one size fit all, and the time is like now for equitable access to both healthcare and relevant treatments. How about you, Sean? What are the upcoming opportunities that you're most excited about?
Yeah, I love this question because again, we get to be hopeful. And just to nerd out a little bit on the tech side, I think there's an incredible opportunity for health tech companies to actually seize on this space, right? I think the companies that we're going to become most successful, especially in the healthcare space on the health tech side, are the ones that are developing the tools that acknowledge the differences in our communities, right? Specifically, there are so many companies out there that are developing clinical decision support systems. Essentially, what they are is it's a tool that bolts on top of your electronic health record. So that if you're at the doctor's office or if you're at the hospital, what it's doing is it's also looking at your characteristics and saying to the doctor or the nurse, hey, be on the lookout. This person might be at an increased risk of heart failure, or like based off of this person's profile, we should also be suggesting, screening for high cholesterol, or the ones that are super advanced are going to be looking at social determinants of health as well. So say, hey, you live in an area that has incredibly poor air quality. Maybe we should be also screening you for asthma or COPD or other respiratory diseases, right? So there is an opportunity for health tech to step in and acknowledge the differences in our populations and tailor the solution that they're providing to healthcare providers, saying, hey, my tool is better than the rest of the ones on the market because I meet your patients kind of where they're at. And so that's incredibly exciting for me, just because, Dr. Kuwahara talked earlier about how, our populations are more susceptible to certain diseases. And that's both on the communicable disease side, but also on like the metabolic and non-communicable disease side. And from a public health perspective, we're really, really interested in making sure that like every clinical provider is looking at the whole person, and they can do that with the technology tools that will be at their fingertips in the near future. So I'm incredibly kind of excited about that. I think the other thing that we're looking forward to is technological tools that incorporate cultural competency and cultural fluency. Everybody wants to talk about ChatGPT or Bard or Copilot, but I think that those tools are still in their infancy when it comes to understanding cultural competency. But I have incredibly high confidence that those tools will continue to evolve and mature. And as they do, will actually be even more beneficial in a healthcare setting for populations that have trust issues with the healthcare industry at large.
I think you're exactly right. We are a rapidly diversifying community, so the innovation and technology advancements and solutions must be equally inclusive. Dr. Kuwahara, what are you most excited about?
I'm most excited about all the innovations and breakthroughs that are already happening in medicine and are poised to really revolutionize the care that we're able to provide for patients. However, as we're moving forward with all of this, we need to make sure we do this in an intentional way so that we're really understanding the nuances in our communities, disaggregating the data so that we are developing guidelines and recommendations that will improve our patients' health overall as we are on this exciting path forward in medicine.
We are on a very exciting path forward. So to wrap up this panel, in the last couple of minutes, I'm going to do a round robin. I'm going to ask you all to talk briefly about what you'd like the audience to take away from this conversation. I'm going to start with Dr. Kuwahara, Sean, and then Linda, or feel free to jump in to add on to each other's responses.
So I think that we need to adopt a comprehensive approach to addressing health inequities. And we really do need to do this comprehensively. We should be doing it across all disciplines so that we're really able to meet the needs of our communities. We also need to be improving what we're doing and building upon what we are doing. So again, to go back to research, research is critical when we're developing our clinical guidelines and figuring out the best ways to care for our patients. But the research is really reliant on robust and comprehensive data. So being able to disaggregate the data by race and ethnicity, understand some of the differences that we might need to explore further is critical. Also, being able to communicate the research findings, communicate clinical guidelines, whether they're US clinical guidelines or if there might be international clinical guidelines that might help us to better care for some of our patients in the US, those clinicians should be aware of those and be able to implement those in clinical practice. And at the end of the day, I think it's important as we're raising this awareness to all work together so that we are addressing these issues head on and not just having it as a secondary thing that we need to think about. If we really do want to reduce health disparities and create a more equitable outcomes, we need to be working on this comprehensively and collectively.
Yeah, I think Dr. Kuwahara hit it on the head, right? It's about working collaboratively, but looking at a person comprehensively. I think that public health departments across the country have been preaching that for a while. Oftentimes we're seen either as the last resort or the safety net, but in reality, our mandate is the health of our entire population that we serve. And so when a population like the Asian American population, Asian American, Native Hawaiian, Pacific Islander population is not assessed effectively, then we kind of get pulled along by the law of averages rather than actually being targeted for the interventions that we need. And so I think it is incredibly important that we're working comprehensively and collaboratively. So we've got community health workers on the ground going to the populace and talking with them. There are clinicians and practitioners at the healthcare setting that are being very competent in terms of how they are treating the patients that are in front of them. And then you've got all the other kind of public health components. So there's immunization, communicable disease, non-communicable disease components that are all looking at our populations at a granular level and trying to see how can what we do on a daily basis impact every community that needs it. And so I think that we can do it, right? I want to make sure that it's hopeful we can do it. The way to do that is to do it together, to do it comprehensively.
Right, to dovetail with my esteemed co-panelists, I think of scalable solutions in addition to the need for comprehensive approach to it. It really is making sure that we're staying on the cutting edge, taking the best of what we learn and making sure that it can scale up. I feel like the programs need to be sustainable, but we always need to be thinking about how to do things better, broader, bigger, take things that work and being able to deploy them elsewhere. Without kind of that continued innovation, I feel like we won't make the ground that we need to make. And we all know that the gaps are quite large. So we just echo all of those things, but a focus on scaling the solutions and making sure that we're taking things into the future.
Thank you, each of you, for your thoughtful responses. Access to quality and culturally relevant healthcare services is not just a goal. It's our shared responsibility that requires collaboration and concerted efforts. And as we move forward, let us remain actively engaged and centered on Asian American, Native Hawaiian, and Pacific Islander communities, and more broadly, communities of color and marginalized communities, to truly foster an environment where health equity is not just the aspiration, but a reality. So thank you again to our panelists and everyone who joined us online for being part of this conversation towards a more equitable and inclusive healthcare landscape. Thank you, everyone.